I am Dr. Saqib Mansoor, and this is my channel, Learning Anatomy. And I have started a series of lectures on the spinal cord, and this is the second of the series of that lectures. And the first of the lectures already most of you seen, and that was an introduction to spinal cord with its various external features, external morphology, sulci, and the fissures. And no, today's topic is the spinal nerve. It's a very detailed discussion of the spinal nerve, covering it each and every aspect. So spinal nerves, they consist of 31 pairs of nerves. 31 pairs of nerves that emerge from spinal cord, and there are 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal, and they contain both motor and sensory fibers. That is, they are mixed nerves. The spinal nerves are mixed nerves containing both motor and sensory fibers. So you see what is the spinal segment. You see here spinal segment. The portion of the spinal cord to which a pair of the spinal nerves is attached is called the spinal segment. You see this picture, and you see this is the H-shaped central gray matter, and this is the peripheral white matter of the spinal cord, and this is the one spinal nerve of the pair. It's a pair. When also on this side, this is the spinal nerve, and I will describe in detail very soon that this is the dorsal root and this is the ventral root. They are attached to this part of the gray matter, which you already know from the first lecture of mine, that this is the anterior gray column and this is the posterior gray column. So this is the attachment of the spinal nerve roots to here, and this is one part of the pair, and other would be attached here, obviously. So this whole part to which of the spinal cord to which the pair of the spinal nerves is attached is called a spinal segment. This is the picture. You can again see, I told you already. So again I repeat, central H-shaped or the butterfly shape gray matter, which is the lying in the center, and this is the peripheral white matter. So this is So you see that this is interior gray column, and emerging from it is the this anterior or the ventral nerve root. It emerges as rootlets, right? And this is the dorsal nerve root emerging from the posterior gray column. This is also from as the form of the nerve root. These are the rootlets, right? These are the rootlets and forming the root. And here you see this is the spinal ganglion or the dorsal root ganglion. This is the swelling, oval swelling, situated on the posterior root, and this is I will tell you in detail very soon. And they unite and they form this your spinal nerve. And as I move this, you see roots of the spinal nerve. This is another picture to elaborate it further. You see this is the spinal nerve formed over here, right? And this is the dorsal root coming, right? This is the dorsal root, and this is the ventral root, right? And they form thus by union a spinal nerve over here, and this all happens in the intervertebral foramen. Yes, this is the intervertebral foramen. You see, this is one vertebra, this is another vertebra, this is the intervertebral disc, and this space is the intervertebral foramen. And so if spinal nerve is formed in the intervertebral foramen. So of course I told you it has two roots, the ventral root, which is motor, and first we describe it like this. I told you already that the anterior root of the ventral root, it emerges at the anterior rootlets shown you already in the picture. and conveys motor output from the visceral and somatic motor neurons. It joins the posterior roots distal to the spinal ganglion, right? This is the spinal ganglion, and this is the dorsal root. So this is ventral root joins posterior root here, distal to the dorsal root ganglion in the intervertebral foramen, and thus the spinal nerve is formed. And this is the dorsal root. So this is the sensory root, and it enters the dorsal lateral sulcus as dorsal rootlets, conveying sensory input from the body via the dorsal root ganglion. Right, this has the cell bodies over here and going there to the dorsal lateral sulcus. So it contains distally an oval swelling. This I already told you, dorsal root ganglion. So it joins this dorsal root and the ventral root in the intervertebral foramen, and it forms a spinal nerve. So a few words again about the spinal ganglion, located within the posterior root. It is located within the posterior root. This is the posterior root here, and the location of the dorsal root ganglion or the spinal ganglion is within the posterior root. It contains pseudo-unipolar neurons of neural crest origin that transmit sensory input from the periphery, with the general somatic afferent and the general visceral afferent to the spinal cord via the posterior roots. So what are the rami? You see, so these are the roots, right? Anterior and posterior roots, which form the by union a spinal nerve, and the spinal nerve divides into two rami, which is the ventral ramus and the dorsal ramus. So rami are to be differentiated from roots. The roots are attached to the spinal segment, and the rami are formed by the division of the spinal nerve. This is the dorsal ramus, and this is the ventral ramus. So the dorsal primary ramus innervates back, skin, and muscles. I will show you the detail. And ventral primary ramus, near its origin, it is attached to the sympathetic ganglion, which lies outside the vertebral canal. Sympathetic ganglion. I'll show you very soon in detail. It innervates the ventral lateral muscles and skin of the trunk, extremities, and visceral organs. Each is mixed. Told you, rami, each of the rami, dorsal and ventral, is mixed. That is motor and sensory. So this I've already told you this picture, right? You can see again, this is the lumbar spinal nerve and its roots, and then the rami. This is the, I told you till this portion it is described in the previous section. So this is the spinal nerve, right? And that's it divides into the ventral ramus and the dorsal ramus. This also contains a meningeal ramus. It innervates meninges and the vertebral column. Then the gray communicating rami, right? What are they? They contain unmyelinated postganglionic sympathetic fibers associated with all spinal nerves. So gray communicating rami and then are the white communicating rami. Gray are related with all spinal nerves, and the white communicating rami, they are found only in the thoracolumbar segments. So you know what is the thoracolumbar outflow, which is the sympathetic outflow part of the sympathetic nervous system, which extends from T1 to L3, T1 to T12, and L1 to L3. So white communicating rami contain a myelinated preganglionic sympathetic fibers and myelinated general visceral afferent fibers, which are the Preganglionic nerves. This is a journal picture. I will discuss each and every part of the spinal nerve components very soon in a step-by-step manner, trying to elaborate it in a very clear and explicit manner, right? You know, this is one over here is shown the somatic part. This is a muscle, voluntary muscle. This is the somatic part, and over here is shown the this autonomic system with the association of both with the spinal nerve, somatic system and the autonomic system both the sympathetic and the parasympathetic. All will try to elaborate everything. So functional components of spinal nerve fibers and their distribution. So let's focus on that. So here we go with the functional components of the spinal nerve fibers and their distribution. So each spinal nerve after the union of dorsal and ventral roots is a mixed nerve and so contains all general functional components. So there are, there are four functional components, which is sensory and motor. Two are sensory, two are motor. What are the sensory components functional? They are the general somatic afferent fibers. They carry sensory input from skin, subcutaneous tissue, and the fascia, and the striated muscles, tendons, bone, and joints to the central nervous system. And then the second sensory component is the general visceral afferent. Of course, this was the somatic component, the somatic system, and the visceral from the viscera carry sensory input from the visceral organs to the CNS. And then the motor components, right? But there are also two general somatic efferent, convey motor out from the ventral horn motor neurons to the skeletal muscle of the myotomic origin. And then second one, which is actually fourth component of the fourth functional component of the spinal nerve, is the general visceral efferent fibers. They carry motor output from the intermediolateral cell column neurons via paravertebral or prevertebral ganglia to visceral organs, glands, and smooth muscle, which is the sympathetic divisions of the autonomic nervous system. So they carry motor output from the sacral parasympathetic nucleus to the pelvic viscera via intramural ganglia. This is a very good picture describing these functional components, right? So first of all, we see the general somatic afferent, right? This is one component. You see this here. You see this is the, of course, contains a discriminative touch, proprioception, pain, and temperature from skin, joints, and muscles. This is a somatic sensation. This is the general somatic afferent component, and it goes like this. And of course, it has to go to the spinal nerve. As this is somatic and afferent, of course, it will go to the dorsal column and via the spinal ganglion, the dorsal root ganglion, and here it's going to the this part, the gray matter, right? Posterior horn, and this is the posterior sensory root. And then this was the general sensory afferent, and then it's the general visceral afferent, carries afferent fibers from the viscera. So this goes from here again to the dorsal root ganglion, the spinal ganglion, and enters this part of the dorsal root. So this is the dorsal root of the spinal nerve. And then other components, these two are the general somatic efferent, right? They motor to the skeletal muscles, somatic system. So of course, they are originating from this anterior horn cell. I told you already, it is motor, and they are coming like this to the anterior motor root, and they are coming efferents to the skeletal muscle, make it contract. And the second part is the general visceral efferent motor to the viscera, right? So they originate again from here to the spinal cord to enter the anterior motor root, and here the spinal nerve is formed, and this is the general visceral efferent going motor to the viscera. So this is a spinal nerve containing all these four functional components: general somatic afferent from the somatic part like skin, joints, and muscles. Then the general visceral afferent, which is sensation from the viscera, and this is the general somatic efferent coming from this spinal cord to the periphery and the effector organ. So this is the here passing, and this is the general somatic efferent, and the last functional component is the general visceral efferent. This is the general visceral efferent. So these are the four functional components part of the spinal nerve. Let's do this spinal nerves association with autonomic nervous system. So the sympathetic component of the autonomic nervous system has closely been association with the spinal nerve. So paired sympathetic trunks extend from the base of the skull to the coccyx, one on each side of the vertebral column, and they are constituted by a row of ganglia, which is the group of nerve cells. Ganglion, this is a group of the nerve cells united by nerve fibers. In the thoracic and the upper two or three lumbar segments, of course, this is the thoracolumbar outflow by sympathetic system. Myelinated fibers run from the ventral ramus to the sympathetic trunk. Right? These are the white rami communicants. So this is the paired sympathetic ganglia on each side of the vertebral column, so extending from the space of the skull to this coccyx. So this is a point. And this is the paravertebral ganglia, cervical ganglia, superior, middle, and inferior, the thoracic ganglia, and the lumbar ganglia, the sacral ganglia, and the what is that ganglion impor? This is by union of these two paravertebral ganglia here close to coccyx. So this is ganglion impor. So this is the whole division, and this is further subdivided, would be studied in the relevant sections, right? You can see but three important things: right and left sympathetic trunks of the chains. Sympathetic, which is the thoracolumbar outflow. Sympathetic trunks, chains are the only related with thoracic ganglia, and the first 2 to 3 number 1. So which these are the splanchnic nerves, and these are the interganglionic connections, and these are the rami communicants. This is I have to describe in detail. These are the prevertebral or the pre-aortic ganglia, celiac, and the superior mesenteric, aorticorenal, and this is the inferior mesenteric ganglion, right? This is the very beautiful picture. So what is a white ramus communicans? You see fibers in the white ramus communicans. First you see the picture in over here. You see this is the white ramus communicans. I enlarge the picture for you just for a while. Then it become more relatively much easier for you to understand the concept. You see, this is first you see what is this, right? This is spinal cord again, otherwise this is the root spinal, the spinal nerve, right? This is the spinal nerve being formed over here, and this is the anterior ramus, and this is the posterior ramus, right? And again, you see, as we're focusing on this part of the picture, that this you see, this is the ventral root, and this is the dorsal root, and you see him talking about the ventral ramus right now, white ramus, and this is the gray ramus. We'll talk later on very soon. So this is the white ramus. It has its origin of the cell bodies in the spinal cord, and see these two blue lines, and you can follow, right? This is the white ramus, and you see here, you see this is a its connection over here, right? Blue lines both going over here, and you can study now that and will understand. Fibers in the white ramus communicans have their cell bodies in the spinal cord. They cross the ventral root and enter the ventral rami. These are the ventral roots, so they are crossing that, and they enter the ventral rami. Right? This is I told you this is the interior of the ventral ramus here, and they are entering that. So within the sympathetic trunk, fibers of the white ramus communicans travel longitudinally up and down. So these are the fibers, right? See this, they are going up, these fibers, white rami communicans, and going down, right? This is the thing. And they end up on the nerve cell in the ganglia over the whole length of the sympathetic trunk, right? As they are white, they extend over the whole length of the sympathetic trunk, of course, which is a thoracolumbar outflow. This is the thing. And then this is again, I've told you this just to enlarge image and paste it over here. So what is that? The gray ramus communicans. You see the picture. This is the gray ramus communicans, and as you see, each ventral ramus receives a slender bundle of fibers of gray ramus communicans from the corresponding ganglion of the sympathetic trunk. Again, I enlarge the picture, and you see over here. You see here, yes. This is the over here. This is the gray ramus. And what is that? And the swelling, this is the dorsal root ganglion of the spinal ganglion. So this is the gray ramus, and it has the origin in the dorsal root ganglion, the gray ramus, and sending it fiber over here to this again ventral root and the dorsal root, right? This is clear, very easy. So this is a part, and then moving on to the next picture. So next slide. The nerve fibers in the gray ramus communicants take origin from the cell in the sympathetic ganglion, shown you already, and these fibers get in the ventral ramus and are distributed to all of its branches. This I've shown you already. Here you go, right? And they also enter the branches of the dorsal ramus as they course back in the ventral ramus. Yeah, right. It's entering back to the dorsal ramus, right? So they're entering the gray ramus fibers, enter the ventral rami and the dorsal rami both. So that was the important discussion. Now the sympathetic nerves, they innervate smooth muscles in the wall of the blood vessels and those associated with their hairy follicles and the sweat glands. Thus, each spinal nerve carries efferent fibers to these involuntary structures in addition to efferents to the muscles which are under voluntary control. So through these nerves, the central nervous system controls the activity of the sympathetic part of the autonomic nervous system. It is important to note that the nerve fibers which connect the central nervous system to the sympathetic nervous system are found only in the thoracic and upper 2 to 3 lumbar spinal nerves, thoracolumbar outflow. We repeated this in many times. So then a word, preganglionic nerve fibers and the postganglionic nerve fibers. So fibers of the wide rami communicantis which terminate in the ganglia of the sympathetic trunk are known as preganglionic nerve fibers. I've shown you the figures, and so wide ray communicantis fibers are the preganglionic ones, and the fibers of the gray rami communicantis which take origin from the cells of the ganglia are the postganglionic nerve fibers. In addition to the gray rami communicantis to the spinal nerves, the sympathetic trunk dispenses nerve fibers through branches which pass on to the arteries of the viscera. So again, I go back to the picture, the full picture. Here you see this, just focusing on more elaborately. So you see, I told you this is the white ramus, and the fibers here are the preganglionic, right? And this is the gray ramus. There's the fibers over here, the postganglionic, right? You see why this the ganglion is this dorsal root ganglion, and this white rami fibers are going to that ganglion, the preganglionic, and as the gray ramus fibers originate from the cell in the ganglion, dorsal root ganglion, is the postganglionic. These are the dotted red, right? So this is the thing. Then this is I told you. What is this? Is a word of splanchnic nerve. So this is the prevertebral sympathetic ganglion and the postganglionic sympathetic fiber, which is the general visceral afferent entering over here, like this. I've told you already in the previous section. So this is the thing. This is the somatic system. This was the autonomic part, and this was the somatic system. This already told you when I discussed with you the functional components of the spinal nerve. So moving on and on, let's go here. So parasympathetic nerves. This is the one component left, and they arise from the second, third, and fourth sacral segments of the spinal cord. They leave the spinal medulla through the ventral root and are distributed to branches of the ventral rami in these segments. So this is the point, and I've showed you the picture already. You could see over here again somewhere, and going back to the main pictures just for a while, right? This would be the S2, 3, 4 over here. So focusing to this spinal nerve again. So it is evident that branches of the nerves to the skin, which is the cutaneous branches, are not entirely sensory, but also contain sympathetic efferents. Similarly, branches to the muscles are not entirely efferent, but also contain sensory and sympathetic fibers. Thus, the signs of nerve injury are not simply paralysis of muscle and loss of sensation, but also loss of sweating, blood vessel control, and loss of control over smooth muscles associated with hair follicles. So from this, we move to the next topic. If this discussion of the spinal nerve is a spinal nuclei. Of course, told you already, the sensory component of the spinal nerve, the sensory nuclei for both general somatic afferent and the general visceral afferent, they are primary sensory neurons, which the first order afferent neurons comprise pseudo-unipolar cell in the dorsal root ganglion of the spinal nerves. And then the sensory nuclei, second order afferent neurons, lie in the dorsal gray column, dorsal horn in the transverse section of the spinal cord. And then the motor nuclei, the somatic efferent motor nuclei lie in the ventral gray column, ventral horn, the transverse section of the spinal cord, and the general visceral efferent cell bodies for the preganglionic sympathetic fibers lie in the lateral gray column from T1 to L2 or L3 spinal segments. Cell bodies of the preganglionic parasympathetic fibers lie in the lateral gray column from S2 to S4 spinal segments. Then we have to see the connections, the nuclear connections, sensory nuclei. Fibers or axons from the sensory nuclei of spinal nerves form various ascending or the sensory tracts, which we'll study in detail in the next topics of spinal cord. When we'll study the cross section, the ascending tract and the descending tracts in detail. But you know the name over here, ascending tracts are the tracts of Paul and Burdach, tracts of Paul and Burdach, vesiculus gracilis and fasciculus cuneatus respectively. They are first order neuron tracts, ventral and lateral spinothalamic tracts, ventral and dorsal spinocerebellar tracts. They're all sensory tracts. Sensory impulses, pain, temperature, and touch reach the level of the consciousness are transmitted to the contralateral post-central gyrus of the cerebral cortex via thalamus. Then the sensory nuclei are unconscious proprioceptive impulses pass to the cerebellum, and the sensory nuclei are also connected with the motor nuclei for a reflex action. So nuclear connections of the motor nuclei connected with contralateral pyramidal, that is corticospinal, and extrapyramidal, which are tectospinal, rubrospinal, levospinal, vestibulospinal, and reticulospinal tracts for voluntary movements, and with sensory nuclei through intersegmental and intrasegmental neurons for a reflex action, for which selectivity is preganglionic, autonomic, sympathetic, and parasympathetic fibers are connected with autonomic ganglia containing postganglionic neuron cell bodies which lie outside CNS. So the course and important relation of the roots and trunks of the spinal nerves. Very, very important thing. So each ventral root arises as a series of rootlets. I told you already from the ventrolateral aspect of the spinal cord. Each dorsal root divides into rootlets which enter the dorsolateral sulcus of the cord. Already told, again telling, the dorsal root ganglia are swellings due to the collection of cell bodies of primary sensory neurons, pseudo-unipolar. So you see and study, this is the picture, right? Each root is closely invested by the pia mater and loosely invested by the arachnoid mater, the later extending as far as the point where the root piece is the dura mater. You could see this is the pia mater. This slide, this closely invest each root, the ventral and the dorsal root, this pia mater. You could see this. And then loosely invested by the arachnoid matter, right? The arachnoid matter invests it loosely. This color is the arachnoid, right? Greenish over here. So here it invests loosely and it extends where the root piece is the dura matter. This is the bluish dura and the root piece that, and the arachnoid extends up till that. So the two roots speaks the dura separately, anterior and the posterior roots. So each receiving a sheath from the dural sheath. where the roots unite to form a spinal nerve. The dural sheath becomes continuous with the epineurium of the nerve, right? So this is the dural sleeve or the dural sheath you could see over here formed like this. See this part and this part. This is the dural sheath or the dural sleeve. This is continuous with the epineurium of the spinal nerve. You already know what is epineurium, three parts of the connective tissue coverings of the nerve, every nerve, which is epineurium, endoneurium, and the perineurium. This is the lumbar spinal nerve I showed you already. So this is continuation of that part. The two roots unite immediately beyond the dorsal root ganglia into a short trunk of the spinal nerve, passes through the respective intervertebral foramen. This is just repetition to make strong concept stronger and reinforce and extend somewhat laterally, beyond which it divides into ventral and dorsal primary rami. This I told you already, right? This is spinal nerve formed distal to the dorsal root ganglion. And then C1 emerges above the posterior arch of the atlas, C2 above the vertebral arch of the axis vertebra, and the successive nerves emerge through their respective intervertebral foramina, right? So C1 and C2 are emerging differently, not through the intervertebral foramina. It's a very important point. This I already told you in my previous lecture, right? So again, cervical nerves emerge superior to the corresponding vertebra, thoracic and lumbar nerves inferior to the corresponding vertebra, and the dorsal and ventral rami of upper four cervical nerves emerge through dorsal and ventral sacral foramina, respectively, and S5 and coccygeal nerve emerge through the sacral canal at its lower end, which is called as the sacral hiatus. So the size of the root varies. It is directly related to the amount of the tissue which it supplies. I told you already that there are the swellings, like there is this one swelling upwards and downwards, which is the enlargement, cervical and the lumbar. This was discussed in detail in my previous first lecture of the spinal cord. The length and direction of the roots, right? This is already told you in detail because it varies, and what is the level of the segment in relation with the vertebra. I told you already in my first lecture. So relation, this is why I'm mentioning, because just to make a coordination and synchronicity of the various points of the spinal cord. So relation is very important anteriorly. Relations of the spinal nerve in intervertebral foramen. You know, these are the vertebra, one vertebra, one other, and this is intervertebral foramen, and relation of the spinal nerve in that. This is the spinal nerve anterior. What is that? Intervertebral discs, right? This is the disc lying anterior to that, and the adjacent portions of the bodies of the vertebra, right? This is the bodies of the vertebra. And what lies posteriorly? Joints between the articular processes of the vertebra. Not shown exactly, but you see and imagine this is the vertebrae and the joints between the articular processes of the vertebra. Then the branches of the trunk of the spinal nerve. After emerging from the intervertebral foramen, each spinal nerve in one or two small meningeal branches, I told you already, and then immediately divides into dorsal and ventral rami. Meningeal branches also receive a filament from the sympathetic trunk. They supply sensory and vasomotor innervation to the periosteum of the vertebral canal, spinal dura mater, and blood vessel. So just one, two sentences about the applied anatomy over here. Very, very important is because disc prolapse, protrusion of an intervertebral disc. Of course, the central portion, the nucleus pulposus, in the lumbar region is quite common. Actually, this is the lumbosacral region, most common. It may compress one or more nerve roots as they pass towards the intervertebral foramina, and the resulting condition is the lumbago, right? This is the low back pain, lumbago. So with or without pain radiating to the distribution of the sciatic nerve, of course, to the buttock and the whole the lower limb parts, this is the sciatica. So I'll do the clinicals of everything now, neuroanatomy detail subsequently and separately. So dorsal rami of spinal nerves. This is very important. Distribution distributed to the skin and muscles of the back of the neck and trunk, and not the muscles of the upper limb which extend over the back. They do not form any plexus. Each dorsal ramus, except C1, S1 to 5, and coccygeal nerve terminates into a medial and a lateral branch, right? Very important. So what are this beautiful picture of this story I told you? Interesting story. So let's see that we're talking about the dorsal ramus, and this is the dorsal root spinal nerve dividing into the ventral ramus, and this is the dorsal ramus. And you see immediately it gives a lateral muscular branch, and then you see here what happens, that this is the lateral cutaneous branch of the dorsal ramus, lateral cutaneous branch, and then it's a medial cutaneous branch, right? And this is very important, interesting. So I told you the area of the distribution, the back and the muscle, which they I will tell you in detail subsequently. This was the point over here, right? And then dorsal rami of the spinal nerve. This is the secondary distribution by medial branch of the C2, greater occipital nerve, thickest cutaneous nerve in the body. Thickest cutaneous nerve in the body is the C2 greater occipital nerve, which supplies to the skin of the occipital portion of the scalp as far as the vertex. Here you could see this is C2. You could see I enlarge for you. Just take a pause. Don't have to make that much of worry. Just to spend more time, and we have to learn and discuss. Let's just see. This is C2 greater occipital nerve, and this splice the area of the scalp. I have a lecture on the splice of the scalp already uploaded on my learning anatomy channel. So this is C2. So this is, you see this anyway, and this is the point C2 splying up to the vertex here. Then we go the medial branch of C3, which is the third occipital, which here, this is the third occipital. I will enlarge you very soon. And it supplies to the skin of the nape of the skin as far as the external occipital protuberance. By medial branches of C4 to C5 to the skin of the back of the neck. So let me enlarge in a while for you. Here you could see, right? So this is the C3, which is the third occipital nerve, right? Third occipital nerve. 3 and the third. And this is splices. And this is C4 and C5. You could see here. And this apply to the skin of the back of the neck. So this is again very beautiful picture. All the dorsal rami of the spinal nerve, cutaneous nerve like. We'll discuss each and every in detail. But medial branches of the T1 to T6, you could see T1 to T6, the medial cutaneous branches. They arise close to the median plane. You see, this is the median plane, and these medial cutaneous branches arise close to the median plane T1 to T6. And they reach laterally as far as the shoulder. These are the shoulder, they're reaching there laterally. Then the lateral branches of T7 to T12. This is the T12 and this is the T7, and they're going from that. And they are the lateral because they emerge away from the median plane. You could see they are emerging T7, T8, T9, T10, T11, and T12. These T1 to T6 are close to the median plane, and T7 to T12 away from the median plane, right? That is why they are called lateral branches of the T7 to T12. So lateral branches of the L1 to L5, I show you this, right? This is L5 level vertebra, and these are the branches. Of course, they would be lower down the spinal nerves. So they run downwards over the iliac crest. This is iliac crest, and splice skin of the gluteal region. Let me enlarge just in a while, a better view. You could see this here, right? So this is L1, L2, L3, L4, and L5. Note the iliac crest and supply the gluteal region skin. While lateral branches of S1, S2, and S3, dorsal rami of this S1, S2, and S3. And what they do, they supply the skin over the medial part of the gluteus maximus. This is the gluteus maximus muscle, this. And form the simple looped plexus deep to the gluteus maximus, S1 to S3. Then the dorsal rami of the spinal nerve, S4 to S5, right? And the coccygeal, they here. And they supply to the skin and ligaments over the back of the coccyx, right? And they form loops on the back of the sacrum. You could see. So then the motor distribution of the spinal nerve, then we'll study that in a detail. So C1 is the suboccipital nerve supplies to the muscles of the suboccipital triangle, namely rectus capitis posterior major and the superior and inferior obliques, and also to the rectus capitis posterior minor and the semispinalis capitis, right? And C2 by the lateral branches, the splenius capitis, longissimus capitis, and the semispinalis capitis. C3 by lateral branches to the semispinalis capitis, and C4 to C8 lateral branches to the longissimus cervicis and capitis, semispinalis cervicis and capitis, and iliocostalis cervicis. C6 to C8 motor branches to the medial branches to the multifidus. Then the thoracic components, T1 to T6 by medial branches to the multifidus and the semispinalis thoracicis. These are the muscles of the back, all the anatomy of the back. So cross anatomy, you will know these muscle names. So T7 to T12, the medial branches, the multifidus and the longissimus thoracicis. T1 to T12, lateral branches to the iliocostalis cervicis levator, costernum, and the longissimus thoracicis. And L1 to L5, bilateral branches to the sacrospinalis, and the L1 to L5 by the medial branches to the multifidus, and S1 to S3 medial branches to the multifidus. So the dorsal rami of the spinal nerves, cutaneous distribution nerves lie on the superficial muscles. On the left side, the limit of the skin or area supplied by the dorsal rami is indicated by the dotted line. This is the dotted line, you see over here. This is the limit of the skin supplied by this dorsal rami of the spinal nerve on the back. And on the, this is on the left side. And what is here on the right side? Nerves are numbered. This is the numbering I told you, shown you already numbered. This is like this, T7, T8, T9. Anyway, so spines of the 7th cervical, 6th and 12th thoracic, and 1st and 5th vertebral label in bold on left side. So also I showed you already. These are the spines labeled. Like which are the 7th cervical, this is C7, and the 6th and 12th thoracic, this is T6 and T12, and this is L1 even, and this is the L5 labeled. This is the spine of the cervical vertebra. So ventral rami of the spinal nerve distribution, right? They are distributed to the skin and musculature of the sides and front of the neck, thorax, abdomen, and pelvis, and to both limbs. Thoracic ventral rami run separately like all the dorsal rami, while in the cervical region, lumbar, and sacral region, the ventral rami unite to form plexus. It's very important point, basic, that the plexus is like the brachial plexus, cervical plexus, or the lumbosacral plexus is formed by the ventral rami, the spinal nerve. You could see just a summary of the system, and then I want to show you this picture discussion. I think that is a little bit imperative. You see, this is roots of the nerve. This is spinal nerve. This I told you, the dorsal ramus. Few words about the discussion of the ventral ramus. What is happening? Like this is, you see, this is a typical spinal nerve, and here it comes the ventral ramus, and here it gives the lateral cutaneous branch. Lateral one divides here into posterior branch and an anterior branch, and this is the ventral ramus, and it's that was a lateral branch, and that is the and this is the medial branch of the anterior cutaneous branch of the ventral ramus, and this is the lateral branch, right? This is the anterior cutaneous branch, right? This is the ventral ramus, and this is its anterior cutaneous branch, and this is its lateral cutaneous branch. Very important. So this ventral ramus divides into a lateral cutaneous branch and a anterior cutaneous branch. Anterior one divides into this lateral and medial branches. This is medial and this is lateral. And the lateral cutaneous branch divides into posterior and anterior branch. It's very simple. And moving on to this summary, ventral root, dorsal root, sensory dorsal root, motor, and they unite, form trunk of the spinal nerve, was mixed, and then the divide into rami, ventral ramus, mixed fiber, dorsal ramus, mixed fibers, of course, understandable. And this is ventral ramus lies muscle and skin over anterolateral body and walls, muscle, skin and limbs. And this dorsal ramus mixed fibers lie deep muscle back and skin of the back. I've discussed that in very much detail. Very important term, just to summary that we know the basic thing. Dorsal root ganglia, what are they? Cell bodies of the primary sensory neurons. And the dorsal and ventral roots, each segment has a pair. And the dorsal horn, the sensory neurons, which is pseudo-unipolar, and the ventral horn is motor neurons, and the spinal nerve formed from dorsal and ventral roots, mixed nerve. So I'm repeating again and again the basic things, which are of course important everywhere to understand, whether it's undergraduate or postgraduate or everything. So the segmental innervation that was described in detail in the previous lecture. So what is that segmental innervation, right? So 2-3 points over here again. So any condition that leads to suppression of the spinal cord or the spinal nerve roots can give rise to symptoms in the region supplied by the nerve. In such cases, it is important to be able to localize the particular spinal segments or roots involved. For this purpose, it is necessary to know which area of the skin and which muscle innervated by each segment. Spinal segment responsible for muscle stretch reflexes also give an important indication about the level of the spinal cord involvement. So eventually, whatever we study anatomy and the neuroanatomy, the important and it's simply it's the applied anatomy. So it's always the applied and the clinical things. So for that thing, though, that the diseases individual one will study separately. We'll get too lengthy a lecture. So already this is going to basically it's a very regarded as a simple lecture. You see, but well, I'm trying to discuss in detail each and every aspect of the spinal nerve, getting lengthy. It has to be because I have to discuss with you each and every aspect. So spinal nerve innervation. One spinal nerve innervates the derivatives from one somite. Go back to the embryology. What is a somite? You know that. So somite gives rise to dermatome, myotome, and this is the sclerotome. So we have to define and then tell you it's dermatome and myotome. The sclerotome is consist of bones and ligaments innervated by the fibers of one spinal nerve. So what is a dermatome, right? It is the area of the skin. Dermatome is an area of the skin supplied by individual spinal nerve, right? So you see this is the vertebra and this is the anterior root, posterior. This is the spinal nerve and here it's supplying one spinal nerve going to supply this area of the skin and this is a dermatome. So this is another point. It's not that a single part of the skin is supplied by only one spinal nerve. There is always an overlap. But this is a theoretical definition. Then we go into the dermatomes clinical significance, which are they? C1. It does not supply any area of the skin. I already told you. C4 supplies the tip of the shoulder. C6 to C8 supplies the skin of the hand. T4 supplies the skin over the nipple. These are the landmarks. T10, skin over the umbilicus. And L5 and S1 supply the skin of the sole. This is it in dermatomes, complete map. This is the interior view and this is posterior view. You could see that. So this is everything. We'll not go into details. It's a separate topic. And, just have to show you the picture and going on. Then what is a myotome? This is the spinal nerve and you see it's supplying this muscle and this is known as a myotome. Group of muscles supplied by single spinal nerve is a myotome. Hardly a muscle is supplied by only one segment. Few exceptions are, uh, what are these exceptions? They are the supplied by only one spinal nerve. All the rest of the muscles are supplied by multiple fibers. So this is the deltoid supplied by only one segment, then the C5. and the intrinsic muscle of the hand by T1, and the inverter of the foot, which is supplied by L4. So then, very important, I have to tell you the Hilton's law. What is that in the relation with the myotome? The segment which supplies muscles acting on the joint, supplies the joint itself, and also the skin over the joint. This is the Hilton's law. And muscle having a common action are usually supplied by the same spinal segments. Very important clinically. And the segmental innervation of certain muscles producing the movements is enumerated in table. Next slide. Here you could see, not going to the detail, but just for interest, I've pasted over here. So this is the movement of the head, right? This C1 to C4, flexion of the elbow, C5 to C6. And this is a beautiful, every movement, important movement is described. This is segmental, right? So even up till this evacuation of the bladder and ball, S2 to S3 and S4, everything. So I thank you very much for listening to this detailed discussion of the spinal nerve. We'll continue the series and we'll finish, very soon. I was busy and upload this lecture a bit late. I was very busy with things and basically tried to prepare the lecture and the images and slides in very hard work. It took me 1 month. And no, but the next things are prepared. We'll be uploading gradually very soon, and needing your feedback. Leave the comment and subscribe my channel for anything about anatomy, and these days we are focusing on neuroanatomy, and I wish you so well. And now for the next lecture, till then, it is goodbye.